Hi, this is Brent Graham. In the May 2020 issue of the Journal of Hand Surgery, our lead article was contributed by Dr. David Ring and his colleagues at Harvard University and at the University of Texas in Austin. This study evaluated a large number of patients with a clinical diagnosis of carpal tunnel syndrome who had been sent for electrodiagnostic tests, and looked at the proportion of patients in whom the findings were close to the cutoff for the electrodiagnostic definition of carpal tunnel syndrome using a variety of different parameters. This raises questions of subtlety in these diagnostic tests and that of diagnostic uncertainty. And the authors speculate on how to communicate this information to our patients that we're counseling regarding this condition. Dr. Ring was my guest at this month's podcast, and we discussed the issue of diagnostic uncertainty in general in some substantial depth. In our review section this month, the Hand Surgery Landscape article is about environmentally responsible hand surgery, both what we've experienced in the past and what we can expect going into the future, a subject that I think is very topical during these troubled times. Our current concepts article is an update on the management of distal radius malunion. Again, another topic that is very commonly written about in the Journal of Hand Surgery and a source of substantial controversy even now. Our Twitter-based journal club will take place on May 12th, 2020 at 9 p.m. Eastern Daylight Time. And I'd also urge you to keep an eye out for the next installment in our series Point Counterpoint. In this segment, our host, Dr. Sanj Kakar, interviews Drs. Dan Osei and Jonathan Isaacs on their views regarding the management of ulnar nerve compression at the cubital tunnel. Again, another controversial subject on which many people have very deeply ingrained views, let's just say that. I think it makes for a very interesting discussion, and I hope that you will enjoy this feature.